Hello, Waco. I'm Waco Mayor Dillon Meek with an update on the COVID-19 situation locally. Like all of you, I want the COVID-19 pandemic to be over. But our local numbers show that COVID-19 continues to create hospital capacity concerns in Waco. This week, we've seen the highest numbers of new daily cases, daily hospitalizations, and daily deaths due to COVID-19, more than at any other point in the pandemic. As mayor, it's my responsibility to bring this information to you so that you can make informed decisions for you and your family. The COVID-19 Delta variant is highly contagious and is infecting more people and younger people than previous variants. In the month of August, 56% of hospitalizations in Waco were among those 60 years old and younger. And 41% of those who died from COVID-19 in the month of August were 60 years or younger. That's a stark contrast from what we saw last year. Unvaccinated patients account for 95% of COVID-related hospitalizations in Waco. Right now, the hospital's priority is ensuring we have the resources necessary to care for both COVID patients and those suffering from other complications of a heart attack or a serious car crash or any other tragic event that warrants immediate medical attention. At the onset of the pandemic, the primary concern for all communities was hospital capacity. Today, right here in Waco, our hospitals are nearing capacity. Let's take a second and talk about what this means, why it's concerning, and what's happening within the walls of our two hospitals. Our ICUs have been full for 2 weeks, and hospitals are managing the volume by moving ICU patients to other areas of the hospitals for treatment as best they can. I've been told of recent cases where people in need of high level of care or important non-elective surgeries have been transferred from our community to other Texas hospitals, sometimes life-flighted, because of our capacity issues here. We saw more ventilators in use in the month of August than at any other point in the pandemic. Elective surgeries and procedures have been rescheduled and delayed. Our emergency rooms are overcrowded and busy, oftentimes with very long waits. Our hospitals will remain open and they will continue giving care as best as they can, but they are in a position of having to make difficult decisions. Our hospital and healthcare workers are exhausted and stretched thin and calling on us for help. If you're vaccinated, you can rest much easier. Millions of Americans have received the vaccine, and while there are breakthrough cases, it is proven to protect against COVID-19, severe illness, and hospitalization. Again, 95% of those hospitalized right now in Waco for COVID-19 are unvaccinated. There are things you can continue to do to help. First, I urge anyone who has not received a COVID-19 vaccine to talk to their personal doctor, ask questions, and make a plan to get vaccinated. If you've been on the fence or have concerns about your safety or side effects, talk to your doctor, just like you would about other important health-related matters. Over 330 trusted McLennan County doctors who have given their lives to the study of medicine signed a letter recommending this vaccine and ensuring Wacoans that it is safe. These are the doctors that you've trusted to care for you for years. You see them at the grocery store, at church, or at a kid's sports team. If you choose not to get vaccinated, you can help too. Please respect how dangerous and contagious this Delta variant is. It is spreading rapidly and the primary cause of our local hospital capacity concerns. Doctors tell us that practices like masking, social distancing, and avoiding crowds will help reduce the chances of you spreading the virus to someone who might end up in the hospital. Currently, about 45% of our community is fully vaccinated against COVID. And in the last 2.5 weeks, over 8,000 people in McLennan County received their first dose. Let's continue to respectfully encourage friends, family members, and coworkers to talk to their doctor about getting vaccinated. Hope remains in Waco. Waco is a resilient city full of resilient people, and we're going to get through this together. The Waco McLennan County Public Health District and other area healthcare providers continue to provide free testing and free vaccines every day. If you need assistance, information, or resources, visit covidwaco.com. There you can find information about local vaccine clinics, testing sites, local statistics, and more. Be safe, take care, and take heart, Waco. I know that there are good days ahead.